Let's talk about clinical practice guidelines. This agenda for the video is as follows. A review of what clinical practice guidelines are and why they're helpful, discuss Boolean operators and controlled vocabulary and their role in creating search phrases, an example of a search in the databases PubMed, CINAHL, and Clinical Key, and provide examples of when to use search filters, and a review of where to find CPGs on agency websites. So, to review what clinical practice guidelines are, they are professionally developed statements created to assist in patient care. Who uses them? Anyone from professional healthcare workers to healthcare providers. Boolean operators are simple words used as conjunctions to combine or exclude keywords in a search. And is used to combine two search terms and retrieve results that contain both keywords, which can limit a search. Or is used to retrieve results containing keywords for either search term, expanding a search. Not is used to retrieve results containing keyword A and excluding keyword B, also limiting a search. Controlled vocabulary can be defined as index terms created by catalogers and database indexers to describe and associate specific terms to retrieve content in a consistent way. These subject headings can be referred to as subject terms, index terms, or descriptors. Each database calls their controlled vocabulary something a little different. PubMed uses the medical subject headings or MESH terms, MESH database. The medical subject headings or MESH terms act as a thesaurus. Clinical practice guidelines in this example isn't found, but practice guidelines as a topic or practice guidelines as publication type are suggested. The MESH terms are organized in a hierarchy, and they are organized by the National Library of Medicine. It is used for indexing, cataloging, and searching of biomedical and health-related information. The more narrow, the more specific. Similar to PubMed's MESH database, CINAHL uses subject headings. In the subject headings database, clinical practice guidelines are recognized as practice guidelines. Databases, searching tips, and filters. Let's look in PubMed and do a live search for a clinical practice guideline. I'm going to look for Achilles tendon rupture, and specifically Achilles tendon rupture clinical practice guidelines. I'm going to type the overarching keyword into the search bar and hit enter. After, I'm going to browse the results. If nothing looks appropriate, then I will look for the additional filters button and check the guideline box. This will appear in the article type section on the left-hand side. Make sure you select it again to retrieve new results. Now I'm going to select a title to show the article record. See the similar articles section for a pre-calculated set of additional PubMed citations closely related to that article. Below it is the cited by information. This is generated using data submitted by publishers and PubMed Central. The bottom of the page will show the publication type of the article. Here is a practice guideline. It will also show the MESH terms associated with this practice guideline. Lastly, use the permalink when sharing this article's webpage. Select the full text icon in the top right-hand corner of the article to access the full text version. Databases, searching tips, and filters. Let's look in PubMed and do a live search for a clinical practice guideline. I'm going to look for Achilles tendon rupture. And specifically, remember that it is wise to use the MESH database in PubMed or subject headings in CINAHL to determine the best indexed words for your topic. In this example, our P, or patient or population, is Achilles tendon rupture. Prior to searching, type Achilles tendon rupture or your P search term into the MESH database to generate the most relevant MESH term. Here, the most relevant is tendon injuries, and the following word is rehabilitation. This is a subheading that was selected because in this PICO, we are looking for recovery times or rehabilitation. When looking for practice guidelines, keep the search simple. Practice guidelines plus keyword and keep manipulating with new keywords, mesh terms, filters, and so on. So here's the mesh record for this topic. So this is the record for the tendon injuries mesh term, which is what we used instead of Achilles tendon rupture. So under the definition, you can see the subheadings. As stated earlier, subheadings are used to indicate an article's focus on a specific aspect of a topic. So here, the best bet was to select rehabilitation. The entry terms below the definition and the subheadings are also known as synonyms that are most related to the mesh term. So it's various ways to say the same thing. And below that is the tree structure that shows the hierarchy of the categories within this topic. I'm not a believer in bad or good. I don't believe that there are bad searches. But know that PubMed does not use plain language. It does not respond to a string of thoughts. It is programmed to respond to index terms and combinations of search terms. So placing your whole PICO question in the search bar will not generate any results. And using too many search terms or too many mesh terms will also not retrieve anything. Similar to PubMed's mesh database, in CINAHL, select the subject headings to search for clinical practice guidelines. Select the practice guideline and select major concepts and search. Then add keywords to find relevant clinical practice guidelines. Scroll titles, view the subject terms below the titles to explore more controlled vocabulary. View the left-hand side of the screen to continue narrowing your search by using filters. Keeping the search phrase simple when finding practice guidelines in CINAHL is your best bet. Recommended route for the first-time searches is taking the major concept, practice guidelines, and adding a keyword or search term directly beside it. No Boolean operators are needed. Clinical Key has its own guidelines section. No controlled vocabulary needed. Select the guidelines icon and then browse by specialties or by alphabetical order. Clinical Key has its own guidelines section. No controlled vocabulary needed. As a reminder, the research guides mention professional organizations and government agencies with guidelines on their websites readily available. One example of an organization's website comes from the American Physical Therapy Association's webpage that offers evidence-based content ranging from clinical practice guidelines to clinical summaries and tests and measures. Thank you, and as always, you are absolutely able to ask your questions through the library chat or by appointment.